I think we're recording. Hello, ladies. I am here with Dr. Ashley Thompson, and she is with Reflection Ridge Chiropractic, and she is going to tell us a little bit about what she does for pregnant and postpartum women and also newborn babies. So we're going to jump right in, and Ashley, I will have you tell us a little bit about yourself.
Okay. I knew that I wanted to be a chiropractor from a pretty early age. I was an athlete and had issues and ended up at the chiropractor's office, and it helped me tremendously. So when I got to chiropractic school, I learned that you could specialize in caring for pregnant women and kids. And I knew I was going to be a mom someday, so I wanted to take the best care of myself and my kids when I was at that point in my life. So I decided to specialize in that, and I absolutely love what I do. Best part of my job is getting to meet a new baby for the first time after I've worked with their mom during pregnancy. So that just makes me so happy, and I just love coming to work every day. So most people, when you think of a chiropractor, you think of going to the chiropractor for neck pain, back pain, headaches, that type of thing. And those are the most common problems that we treat. However, the whole basis for chiropractic is that the brain and the nervous system control everything in the entire body. So the main component of that is the spinal cord, which runs through all the bones in the back. Then you have all those different branches of nerves that branch off and go everywhere. So a pinched nerve doesn't just cause headaches, neck pain, back pain. Pinched nerves can cause all kinds of internal issues: constipation, diarrhea, acid reflux, colic in babies, recurrent ear infections, you name it. So chiropractors use gentle pressure, put the bone back into place, take pressure off the nerve. Why in the world would a pregnant woman need to go see a chiropractor? If you are pregnant, I'm sure none of you have had back pain or neck pain or hip pain or pubic pain or anything like that, but your body goes through so many changes when you're pregnant because of some of the hormones that loosen and relax all the muscles and ligaments in your body, the extra weight that you have, your shape changes when you're pregnant. So all of that stuff biomechanically is just very, very hard on your body. So seeing a chiropractor who knows, who specializes in pregnant women while you're pregnant can help you feel a lot better during pregnancy, but you're typically going to have a lot easier labor and delivery. You know, your pelvis is what makes up your birth canal. So if something is stuck and not moving correctly in that part of your body, then you're going to struggle when you give birth. You need everything to be moving. You need baby to be positioned really well.
And that is something that you do too, right?
Yes.
Okay.
Yes. So if you Google chiropractic and pregnancy, a lot of times what's going to come up is the Webster technique. And the Webster technique is just a real specific technique used to adjust pregnant women, but pays particular attention to the lower back, pelvis, your ligaments that support all of that area. And so a Webster technique certified chiropractor just has extra training to work with pregnant women.
Okay.
So
I'm gonna grab a tissue, sorry. And when a baby is breech, is that when primarily you do Webster technique?
No. So anybody in my office that is pregnant is going to be adjusted Webster. And
okay.
Well, I always throw in a bunch of other stuff, depending on what your typical problem is. But definitely when a mom comes in and presents with a breech baby, and statistically in the research, there's about an 85% success rate with breech babies. And the Webster technique, my success rate in my practice is a little bit higher over the 11 years I've been doing this. But
how early on do you want to see moms once they know their baby is breech?
As soon as you know your baby's breech, you want to get in. In a perfect world, babies are head down by 32 weeks. So absolutely by 32 weeks. That being said, sometimes women come in at 38, 39 weeks and we're still able to be successful with that. But why chance it?
Yeah.
Get in early.
Yeah.
Get in early and get it taken care of.
Okay. And so for anybody that doesn't know specifically, what's the protocol with newborns? How early do you want to see them? What are the signs and symptoms moms are looking for that they would want to bring a baby to you?
All my moms that I treat when during their pregnancy, I always say, as soon as you feel like getting out and about, out of the house, come in and we'll check baby out. So sooner rather than later, the birth process, even if it goes 100% perfect, it's still a little traumatic on mom. It's still a little traumatic on baby. So, you want to get everybody checked out as soon as you can. Signs that your infant may need to be adjusted is, if they can only turn their head a certain way, or if they're favoring their head one side. A lot of times babies will nurse really well on one side and they won't nurse well on the other side, and that's because of the range of motion in their neck. tummy issues, constipation issues, spitting up, just general unease, babies that don't settle, babies that are uncomfortable in their car seat, babies that hate laying on their backs. Those are all typical signs that they're just uncomfortable.
Yeah. And do you have any protocols for what mom can eat or not eat? Is any of that address the mom as well?
Yeah. So, moms always bring babies in. We kind of I start with, a musculoskeletal exam and kind of see how they're moving, that kind of thing. I would say probably 20 to 25% of my moms, we have to change their diet in some way.
Yeah.
And the most common thing is dairy. That's obviously the most common thing. But if you yourself as a mom have underlying gut issues, or you have a history of food sensitivities in your family, we'll kind of start with that and go from there. So
kind of process of elimination.
Yep.
Okay. Let me check out. Is there any other work that you do that you feel would benefit everybody knowing?
I don't know. I specialize in pregnant women and kids, but I treat people of all ages. And chiropractic, it's not a cure-all for everything, but it sure does make your body function better.
Yeah.
So it can help a lot of different problems, and a lot of people don't realize what all it can help with.
The magnitude, the reach. What are you guys doing anything for fertility in women?
Yes, I'm getting ready to launch a program on that here first of the year. And the fertility program I'm doing, it's going to involve chiropractic, but also nutritional, a bunch of nutritional support. So the reason I'm getting into that is because the longer I've been in practice, the more and more women I have or have talked to that are just struggling with infertility. Most of us know that living in the United States, we don't have the best health in this country.
Mm-hmm.
And so, it's manifesting in a lot of different ways, but one of those is infertility. So, pretty excited about getting that done. Been working and studying and training with a bunch of people across the country, getting that up and running, and, trying to have that as ready to go as we possibly can when we launch that. So
when that launches, where can people find that?
I'll have it on my website. I'll have it on Facebook. I'll make sure that everybody knows that it's out there.
Yeah. Okay. What else can I ask you here?
I think that covers it, really.
Yeah. One quick question, because this comes up in so many women. Is there anything that women can be doing specifically at home when they're not seeing you to help with pelvic pain? More often than not, I hear so much issues with pregnant women and pelvic pain. So is there anything that they can be adding to their workout routine, taking away, or is it just kind of an individual case-by-case situation?
There's some general stretching and stuff that you can do, your piriformis, a lot of iliopsoas, stretching, that type of thing. But, working out, staying strong, in a perfect world, you're going to plan to get pregnant, and you're going to take steps before you even get pregnant to get your body where it needs to be. But, strength training, all the stuff that she does, that's what you need to be doing.
Yeah. Yeah, I didn't actually experience pelvic pain until my 4th, and it was not fun. It was pretty brutal. And at first it was kind of like, whoa, what is this? What's happening? And
I think pelvic pain, especially that pubic bone, I think that's probably the most painful thing that you can possibly have during pregnancy. So
yeah, it's rough. So what is your Facebook page, and then what is your website?
So my website is newbeginningswichita.com, and there's a bunch of videos and resources and stuff on there. My Facebook page is Dr. Ashley Thompson. And then in the process of getting Instagram set up, so I'll get that. I'm not super tech savvy.
It's just one more thing to maintain.
One more thing to do that just has been on the list and has not gotten done.
Yeah.
So Instagram, I'll post different stuff than I have on Facebook and that kind of thing. So.
Yeah, nice. Okay, well, thank you for your
thank
time
you,
today.
Lauren.
I appreciate it. All right. For all.